Do you have pain in the bottom of your feet with the first steps in the morning? You may be dealing with plantar fasciitis, and in today's video, we're going to go over all things plantar fasciitis. My name is Dr. Marco Lopez, doctor of physical therapy and certified strength and conditioning specialist, and co-founder of the Basketball Doctors. So what exactly is that pain in your heel or in the bottom of your foot? So that's coming from your plantar fascia. So the plantar fascia, just think about this fibrous tissue, which is going from the heel all the way up to your toes. And that fibrous tissue is very important for several reasons. One, that fibrous tissue is accepting the load whenever you're walking, running, jumping. So it's really gonna help absorb the force on the foot. Two, it also helps provide stability of the foot as well. And then three, it also helps just propel the foot forward, do actions of concentric. So not only the eccentric portion, but also the concentric, the taking off. And this is very important because this fibrous tissue, a lot of the times people think it's more inflammation because of the name plantar fasciitis. But in reality, it's more thickening, degeneration of this fibrous tissue, which may lead to some inflammation along the foot, but it's mostly more that thickening, degeneration of that because of over time, irritating that plantar fascia. And then it's going to lead to tightness up the chain because the whole fascia plane is connected. So that bottom of the foot pain, it's all that plantar fascia and it's that fibrous tissue. And that's why you'll see people describing it as that sharp pain going in the bottom of their foot all the way to their toes. Now that we explained what that pain is coming from, so how do you know if you have it? So the number one hallmark sign for having plantar fasciitis is the first step in the morning. So when you're sleeping and you wake up and you take that first step, people normally have that stabbing sharp pain in the bottom of their foot. It might start at the heel, others have it from the heel going all the way up to their toes. And that big pain there is from that plantar fasciitis. And that is normal. That's one telltale sign that we could tell right away. That pain also will slightly get better as you start moving and getting that plantar fascia just a little bit more mobile throughout the day. However, this pain is also possible to come back after you're in a prolonged period of rest. So meaning let's say you're sitting down working at your computer for 2 or 3 hours, then you take a step, you might have that pain as well. So not only is it when you wake up, but it's also when you have that prolonged period of not doing much and your foot's in a static position. And sometimes it gets better when you start doing some more movements because you start moving the plantar fascia, you start moving the foot, mobilizing it. However, when you do too much activity, you also might flare up the plantar fasciitis. So some people have it where if they're working, let's say, delivering packages or they're on their feet working at an event, they'll notice, after several hours, their feet are starting to have that sharp pain in the bottom of their foot. And that's because of that prolonged period of time being on your foot. And that's going to irritate the plantar fascia. So to recap it, it's the first step in the morning is the most painful step. That's a good sign that you probably have plantar fasciitis. But don't be alarmed if it also gets flared up when you're sitting for a long period of time and you stand up, let's say at work. And then normally it gets better with some slight movement, but if you do too much movement, it's also going to flare it up. I know it's kind of tough, but those are the big signs for plantar fasciitis. Now we're going to talk about who's at greater risk and who gets it. So the number one thing is high impact activities. For example, basketball. As you're playing these sports, it's going to increase the demand for the plantar fascia to work. As we talked about, it helps support your arch. So whenever you're running or doing all these activities that involves jumping, puts the plantar fascia in much more stress. And if the plantar fascia is not ready for that, then it might lead to that plantar fasciitis over time. The second one is improper footwear. So as we talked about the arch support, if you have a fallen arch, that already increases your risk for plantar fasciitis. But if you don't have the foot support or you don't have orthotics early on and your foot just keeps pronating over time with activity, that also increases your risk for plantar fasciitis. The third one is weak muscles in the foot. So if you don't have strong muscles in your foot and ankle, what happens is these muscles aren't going to be able to support your arch. For example, the posterior tibialis muscle. What happens then is the plantar fascia, then it has to take a lot of the toll. When it takes a lot of the toll, then it starts getting irritated over time, and that's what leads to plantar fasciitis. Another big thing is you also want to watch your weight gain. We've seen a lot of people that increase their weight, their plantar fascia is not ready or isn't used to this increased weight gain. And that also is going to irritate it because now you have more weight, more forces on the plantar fascia and it's not used to it. And that increases your chance for plantar fasciitis. We also have overpronation or foot mechanics. So what happens is you might have strong muscles but you still don't have proper control of making an arch. And that's why there's several exercises you can work on to create that arch. It's called the short foot exercises. But the big thing is that your foot just overpronates. When it overpronates, then it's just going to be irritating the plantar fascia. So really working on your foot mechanics, be able to create an arch. The other one is the big one, and it's the tight calf muscle. So these muscles in the back, your calf, your gastrocsoleus, they go down to your heel that attach to your Achilles tendon, and that then gets together with the plantar fascia. What happens is those muscles get tightened up, increases your risk for having a little bit more forces in your plantar fascia, and then you also don't have good dorsiflexion range of motion, meaning your ability for your ankle to move forward when you're walking, and that's going to force you to come into more of a pronation position, which is going to put more stress on that plantar fascia. So restrictions in the calf muscle will go down and change the mechanics in your foot and increase your risk for plantar fasciitis. And this kind of goes back to what we mentioned with the fascia. So the plantar fascia, it gets thickened and then it changes the position and causes tightness up the chain. And then the last one, and this one gets often overlooked, and it's an increase in activity. So you might have all the right things. You might have good foot strength, good mechanics, but then if you have an increase in spike in activity and your body's not ready for that, that's going to put some more pressure in the plantar fascia that it's not used to, and that increases your risk for plantar fasciitis. And it's usually a gradual. People usually say, hey, I started playing basketball 4 days a week, and then after a month, they'll start having some plantar fascia issues. But those are the main reasons or some of the risk factors that you might have for plantar fasciitis. All right, guys, so those are the big risk factors, and all these contribute to the main thing when it comes to plantar fascia. As we mentioned, it's a fibrous tissue in the bottom, and it's usually due to degeneration over time. So think about the bottom of your foot having this rubber band. So when we stretch it out often, this strong rubber band, doing these activities overstresses that plantar fascia and overstretches that rubber band. Over time, when you stretch that rubber band so many times, it's going to cause some micro tears, and that's what causes this degeneration of the plantar fascia and irritation. So initially, the big goal that we want to do with plantar fasciitis is address these risk factors that we talked about, making sure you have good foot mechanics, having good foot strength, having the proper footwear, not ramping up your activity too much, and keeping your weight gain on check. These are all going to put you in great positions to decrease your risk for plantar fasciitis and also treat plantar fasciitis, because most likely or not, you have one of these. These are some of the reasons why you have plantar fasciitis. But if you guys have any questions regarding plantar fasciitis or any questions about treatment or need help with your rehab, send us an email or comment below. We'll try to answer as many questions as we can with videos. And if you like this video, share this with friends and family. Hit the like button, subscribe to our channel. We are the Basketball Doctors. Let's ball for life.